So first question I have for you guys is, have you had back pain before in CrossFit? Yeah. And that makes sense. Pretty much everybody will at some point. And it's not that CrossFit is bad, right? In research, the injury rates between CrossFit, weightlifting, and powerlifting are all about the same. CrossFit is actually way lower than runners and way lower than sedentary people. Yeah, which is crazy, right? So when people hurt their back in CrossFit, they think, oh, maybe if I just rested, it'd be better. But in reality, sedentary people, one, don't bounce back as quick. Part of it is CrossFitters care about movement a lot, so they reach out to a rehab specialist quicker. But also they're just more resilient, right? Because they built that baseline strength.
I think it's my sedentary job that has caused most of my problems.
Exactly. Yeah, right? Exactly. And then second question is, what have you guys been told about that causes back pain? It could be from a different PT, a doctor, what you've seen online. And it doesn't have to be your own beliefs, just what you guys have heard. So I can write them down and then we'll address them as we go. Yeah. Bad posture. Okay.
Sitting all day at work.
Yep.
And some people feel really strongly about back squats.
Okay. What's that?
My one hip is weird. And it pulls like everything to one side.
That's hilarious. Okay, so is that one that you've heard? Hip flexor strength? Okay. I hope by the end of the day that you guys have like a simpler understanding of what's going on. Because there's a lot of different factors that can lead to pain, right? Anatomy, physiology, movement habits, sleep, stress, like all those things can be combining, right? So it's much easier to just simplify it down. So I like to use this 3 triangle thingy you see here. So 3 things can cause pain. It can be position, which you were saying, did you say posture? And then sitting, right? That could be a position intolerance, right? You're in that position, your back doesn't like that position, right? And specifically to the low back, it could be flexion, extension, side bending, rotation, like in CrossFit movements. And then load. So an example would be what did you snatch today? 85. So let's say at 75, okay, 80. Let's say at 75 pounds, your back started flaring up. That would be your load tolerance threshold. So if you went to 80, it would hurt, right? Versus 70, maybe you would feel fine. Okay, and most of the time it's a combination of these 3. It's not like a specific one of them, okay? And then capacity is probably the most common one in CrossFit. A guy that I was recently working with did 225 on deadlift for 6 on the first day, but he had pain with it. When we were done with him, he did 21 reps in a row, 225 without pain. So he had a capacity issue. So that's what we were working on in rehab. Okay, what about movements? So I had the first letter. These are the most common movements that cause back pain in CrossFit. Boom. Yeah. It's like what is that called? Yeah, there you go. So deadlift. That is number 1 for sure. What? Oh, actually that is not on the list, but that definitely could happen from overextension, right? Olympic lifts is what this one is. I made this one hard. It's Olympic lifts. Squats, yeah. Yeah. GHT, I gave you 3 letters.
That's the only thing I caught.
Sit-ups, yeah. GHT sit-ups. And then toes to bar.
Yeah.
And this is not part of it. We're actually going to do this exercise. So deadlift, Olympic lifts, squats, wall balls, those are typically a flexion injury. So like in a deadlift, sometimes people go like this and then they hurt their back. And that's not necessarily a bad position to be in if you've progressively overloaded it. Like if you look at some of the best power lifters, some of them don't have perfectly straight backs when they lift, just because their anatomy makes it easier for them to lift heavy with a little bit of flexion. But if you've never trained in that position, that's where you get injured, right? And then squats are similar, right? Like the cave there. Wall balls, yes. Yeah, I remember over here.
We're working on that one.
And then the wall balls typically are at like a higher rep, so that's more like a capacity issue, right? Nobody's having trouble with a 14-pound wall ball, especially if you're in CrossFit. And then GHD sit-ups and toes to bar are more like extension intolerance to the back. So we're going to work on positional tolerance a little bit. Have you guys ever heard of a Jefferson curl?
What?
A Jefferson curl? Heard of it?
I think we did them recently.
We did them yesterday.
Oh. I was not here
In the warm-up we did. Yeah. What's that?
Jefferson Park?
Jefferson curl. We did it in the warm-up. I don't think we used weight, but I'll show you. How about that?